Today, we're talking about Wesnatal Dha Complete 29 mg Iron-1 Mg-200 Oral Pack Multivitamins. This medication is a combination of vitamins, minerals, and fatty acids, which are essential for the body, especially before, during, and after pregnancy. It also includes iron and folic acid, important for women of childbearing age to prevent spinal cord defects in their developing baby. It's important to maintain adequate levels of folic acid through diet or supplements. The daily dosage and optimal timing for this medication may vary, so it's best to consult with your healthcare provider. Taking it with food or a full glass of water can help prevent stomach upset. As always, it's important to follow the guidance of your healthcare provider when taking any medication. When taking Wesnatal Dha Complete 29 mg Iron-1 Mg-200 Oral Pack Multivitamins, it is recommended to take it by mouth, usually once or twice daily as directed by your doctor. If you are taking the powder form, mix it in water before swallowing. For the delayed release form, do not crush or chew. It is best taken on an empty stomach 1 hour before or 2 hours after meals with a full glass of water, unless directed otherwise by your doctor. If you experience stomach upset, you may take it with food. Avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they can decrease its effectiveness. It is important to take this medication regularly at the same times each day to get the most benefit from it. Some common side effects of taking Wesnatal Dha Complete 29 mg Iron-1 Mg-200 Oral Pack Multivitamins are constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to speak with your doctor or pharmacist. Iron in the medication may cause your stools to turn black, but this is not harmful. This medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Most people who use this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as easy bleeding or bruising. While it is rare, a very serious allergic reaction may occur. Seek medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist for advice. If you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to note that accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Therefore, it's crucial to keep this product out of reach of children at all times. In the event of an overdose, it's important to seek medical help immediately or call a poison control center. Before starting Wesnatal Dha Complete 29 mg Iron-1 Mg-200 Oral Pack Multivitamins, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients, fish, or soy/peanut. It's also crucial to disclose your medical history, especially if you have conditions such as iron overload disorder, alcohol use/abuse, liver problems, stomach/intestinal problems, vitamin B12 deficiency, or bleeding disorders. Additionally, if you are planning to have surgery, it's essential to inform your doctor or dentist about all the medications and products you are using. Furthermore, this medication is safe to take during pregnancy when used as directed, but it passes into breast milk, so it's important to consult your doctor before using it while breastfeeding. It's important to be aware of potential interactions with other medications when taking Wesnatal Dha Complete 29 mg Iron-1 Mg-200 Oral Pack Multivitamins. This product may interact with medications such as chloramphenicol, certain anti-seizure drugs, and methyldopa. It can also decrease the absorption of other drugs like bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. To minimize these interactions, it's recommended to separate the doses of these medications as far as possible from the doses of Wesnatal Dha Complete 29 mg Iron-1 Mg-200 Oral Pack Multivitamins. Be sure to consult your doctor or pharmacist for guidance on how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If you or someone else has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., you can contact your local poison control center at 1-800-222-1222, while Canadian residents should call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to remember that this medication is meant for your use only and should not be shared with others. Your doctor may recommend lab or medical tests, such as a complete blood count or checking your vitamin B12 levels, while you are taking this product. Be sure to attend all scheduled medical and lab appointments and consult your doctor for more information. Some brands of prenatal vitamins may also contain additional ingredients like calcium, zinc, iodine, or docusate. If you have any questions about the ingredients in your brand, it's best to consult your doctor or pharmacist for clarification. It's important to note that this product is not a replacement for a balanced diet. While taking this medication, it's best to continue to get your vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. If you forget to take a dose of Wesnatal Dha Complete 29 mg Iron-1 Mg-200 oral pack multivitamins, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take a double dose to make up for the missed one. It is important to store Wesnatal Dha Complete 29 mg Iron-1 Mg-200 oral pack multivitamins at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.